Welcome, everyone. I'm Lisa Silverman. I'm your facilitator for today. Our talk today is on the evolving role of telehealth and pharmacy, and I'm excited to bring it to you from my coworkers, Heather Bonome and Jen Richards. Heather's our director of pharmacy here at URAC, and Jen is one of our product development principals who happens to be a pharmacist by training. And Heather, I'm going to turn the floor over to you and just tell me when to advance your slides.
Perfect. Thank you so much, Lisa, and thank you everybody for joining us today. We're really excited about today's session. Today's session is a little bit different than some of the other presentations and webinars that we've hosted. Jen and I actually had the opportunity to attend the Assembia Summit a couple of weeks ago. And this is the same or similar content to what we presented there. We've been really fortunate to get to present pretty often at Assembia. We're usually presenting on accreditation standards, the latest and greatest in standards that we've released, or interacting with folks to get feedback on how we might revise our standards. But this year was a little different with all of the activity happening with telehealth in the past couple of years and all of the buzz around that. These folks at Assembia recognized that URAC has quite a bit of expertise in the telehealth space and asked us to talk about telehealth and that intersection with pharmacy. And so that's what we presented, and that's what we're excited to talk with you all about today as well. I'm going to kick things off today with a background and some level setting, and then I'm going to transition to Jen Richards. She's really going to do a deeper dive into the content and talk about what we've been seeing. And then we also are going to have some focus time at the end where we'd like to interact with you through the chat function. We'll be able to take questions. And then because this is an evolving space, we want to hear from you about what you are seeing and what you are doing. Right, but again, just a little bit of level setting before we dive too deep into our content. For those of you who aren't as familiar with URAC, URAC is a leading national accreditor. We are a nonprofit organization, and we're an independent accreditor. And that really means that we provide accreditation reviews, we offer education, but we don't offer consulting services. And what do? We validate quality through the healthcare landscape. And I want to take a quick pause to talk about how we do that, because I think that's important to today's discussion. So we engage industry experts and form advisory groups. And we ask these advisory groups, what are the most important principles, functions, practices that make a certain healthcare organization a quality organization? What are those functions that result in the best patient care? And we take all that information that we glean from these advisory groups and we translate them into standards. And actually, when I say we translate them into standards, I mean Jen translates them into standards. She's one of our product development principals, and that's really her role, to facilitate these expert advisory groups and to help to write the standards. We take those standards and then we group them into programs. And then those are the accreditation programs, and our team holds organizations to those standards. And when those standards are achieved, we get to recognize and celebrate those organizations. So we've actually become experts ourselves through all of our interactions with the advisory groups, as well as our experience of conducting literally hundreds of accreditation reviews every year. Next slide, Lisa. Perfect. Many of you in this audience, seeing that about half the participants are representing specialty pharmacies, are likely pretty familiar with our specialty pharmacy program and the fact that we really are the leader in specialty pharmacy accreditation. You may not be as familiar with the fact that we are also the leading accreditor for telehealth organizations. We've been doing telehealth accreditation for a while. In fact, our first advisory group in this space was convened back in 2014. For a while, there was another accreditor in this space, but a few years back, we acquired them and took the best of both programs and have continued to work with industry experts to revise and refine those programs, which results in the program, the telehealth program that we have today. Next slide, Lisa. Great. And today is not a session where we're going to do a deep dive into our accreditation standards, so I'm not going to spend a lot of time here. Those of you who are familiar with our specialty pharmacy accreditation will recognize the topics in these boxes as our focus areas, how we group the standards within the specialty pharmacy accreditation program. And along the top there are the focus areas that we often refer to as our foundational focus areas. So those really foundational principles that when employed can result in good quality practices really in any healthcare organization. Next slide, Lisa. So you'll see those same foundational focus areas on the top here. Those are also part of URAC's Telehealth Accreditation program. Now, there are some specific standards that are added in here. So, for example, in addition to having a clinical director, which we're familiar with for a lot of our programs, if you're seeking telehealth accreditation, you also need a technical director, someone who's responsible for the integrity, for the interoperability of your program. So similar principles, but some refining to make sure that it applies to the telehealth accreditation as well. And on the bottom here, we have those focus areas that are specific to the telehealth program itself. Telehealth operations will include things like, is the organization licensed and authorized to provide telehealth services in a certain jurisdiction? And again, how does that organization make sure that they're maintaining the operational capacity and capabilities to provide telehealth services? Patient encounters, there are a lot of additional things you need to consider in the telehealth space, such as how is the patient and provider identifying themselves? How are documentation of encounters being identified? Patient consent, how is that being confirmed? How are financial disclosures? So a lot of things that in a less traditional setting, you need to think about how that's all going to be operationalized. And of course, in any of our programs, we want to make sure that the clinical care that's being provided is appropriate. So what are those clinical guidelines that are being utilized within the program and the services that are being offered? Jen, do you have anything to add if we look at these?
Yeah, so I think going back to patient encounters, we see that that's a pretty big area where, this is a very different way to deal with and work with your patients. So in the pharmacy space, typically we see, you have that patient-provider relationship pretty easily through a prescription, right? As pharmacists, as we develop new ways of interacting with our patients, new services we can provide them, that patient-provider relationship needs to be defined a little bit more. And that's something that in the pharmacy space, that may be something that people need to work through a little bit more as they're thinking about telehealth and telepharmacy.
Excellent point. Thank you. Thanks for sharing that. Lisa, the next slide. Thank you. So again, as part of the level setting, we want to recognize that telehealth has a lot of different meanings depending on who is talking about it. We thought it'd be worthwhile to review the types of telehealth that CMS recognizes. So I think a lot of us think about live video, that two-way, face-to-face interaction, usually using some kind of audio-visual connection between a patient and provider. But e-visits also can be considered telehealth, and this is really that more non-face-to-face patient-initiated communication, usually sort of through some sort of online portal. And there's remote patient monitoring, where health data is collected and then electronically transmitted to the provider to review and make healthcare decisions. Audio-only visits, so certainly the telephone can frequently be used to provide patient care. Mobile health, where you have the patient, or a patient has the ability to review their personal health data through maybe a mobile device, their telephone, a tablet, often through an app, and the ability to communicate that way. And then also case-based teleconferencing. So bringing together a collaborative, usually multidisciplinary group of individuals sometimes including the patient as well as caregivers as well, to come together, review that patient's case, and make healthcare decisions. Next slide. And it wouldn't be a presentation in 2021 if we weren't going to talk about the pandemic. So let's talk about how the landscape for telehealth has changed during the pandemic. But let's take a step back. And so before the pandemic, there was relatively low utilization of telehealth, and there were some barriers to coverage there. If we think about Medicare limited the coverage areas. They limited the number of services that could be provided through telehealth, and they limited the technology that could be used. Before the pandemic, it was really the technology companies that were driving telehealth versus the providers. During the pandemic, there was a lot of activity and a lot of people got on board. Congress, providers, payers, patients, state regulators, CMS, a lot of those restrictions we just reviewed that were in place before the pandemic were relaxed so that telehealth, when it became so important, could be utilized. And so as we transition to, hopefully after the pandemic in the not too distant future, it'll be really interesting to see what new players come to the landscape, and then really what the policy landscape is going to look like. So all of those restrictions that were suspended or relaxed, are they going to stay? Are some going to be implemented again? There's still a lot of open questions about what that regulatory landscape is going to look like. Next slide. So we expect, because of the growth in telehealth, that we'll see even more players, but it's already a pretty crowded landscape. And this is just a snapshot of some different areas of organizations. They're kind of grouped together here. If you look at the top left-hand corner, telehealth and virtual care, this is really the group of folks that we accredit. So the teledocs and the 98.6, Station MD, these are organizations that have sought and achieved accreditation through URAC's accreditation, Telehealth Accreditation program. We also see some pharmacy organizations here. There are some digital pharmacies listed here that have sought accreditation. There are some niche telehealth organizations that have their own pharmacy. So when prescribing results from a telehealth encounter, the pharmacy can go ahead and just dispense that medication. So a lot of innovation, a lot of organizations already around, and we're excited to see who else comes our way. Right, so with that sort of background, I am going to transition to Jen, and she's going to do a little bit of a deeper dive into our topic.
Awesome, thank you, Heather. So we have discussed the types of telehealth as defined by CMS, but I wanted to level set on some of the terms that URAC uses and how we view those definitions or those terms. So starting with telehealth, this is kind of that broad, overarching mode of care delivery. This would, telemedicine falls underneath telehealth. There's also telepharmacy that falls under telehealth. But it's basically this big, huge, broad category of delivering care that is facilitated by technology. In telepharmacy, when we talk about telepharmacy, that care that is being delivered or facilitated through technology is directly related to pharmacy services. We also use the term digital technology to mean the support behind communications with the patient. So this is not the actual service being delivered, but it enhances the ability of providers to provide the care or the service that they're trying to provide. So these are the broad topics or the broad terms that URAC uses when we are looking at telehealth, telepharmacy, and how those intersect. Next slide. So specialty pharmacies have been providing services and care virtually for a very long time. This is not new. This is something that specialty pharmacies are really good at. They find value in providing care to their patients through virtual encounters, typically through the telephone. As telehealth was taking off, specialty pharmacies have been able to leverage their virtual practice model to embrace the new technologies that were being developed and used through the telehealth takeoff to enhance their own care delivery models. So it was not a place of starting with nothing. It was being able to enhance what you already had throughout telehealth taking off. So next slide. So we wanted to start here with just a brief discussion. We talked a little bit about telehealth, telepharmacy. So what have you seen in your practices and what are you currently working on? So if you will use the chat box, we'll go ahead and give you just a couple of minutes to put in things that you've seen with telehealth and telepharmacy intersecting, or telehealth intersecting in pharmacy, I guess I should say, and the things that you're working on and how you're bringing telehealth and digital technologies into your own practice.
And Jen, let's also say, this is Lisa chiming in again, that somebody may not be working on it directly, but it may be something that they're thinking about or something that they've come across or something they'd like to work on, or even if there's an area where they could actually use some help connecting with somebody. So share your successes. No success is too small. And tell us what you're working on. You can use the chat box. We are not opening the phone lines because we actually have a good number of people here today, which is fantastic. But please chime in with what are your thoughts on what you've seen and what you're working on, or even what's in your 5-year dream plan for what you'd like to be working on.
Yeah, and we see a lot of things. I know one of the things that you had just said, Jen, was that, which we certainly see a lot of teleconferencing and telephone utilization in the specialty pharmacy space, given that it's really grown up as a virtual practice in many ways because so many specialty pharmacies are closed door pharmacies. I was just yesterday was talking to one of our reviewers who had just completed a review with an organization that had a whole video set up so that they could do video conferencing with their specialty patients. And it's just really cool and really fun to see these practices evolving.
So we have a comment in here. Laura Rang's asking about platforms used to perform assessments that are HIPAA compliant and automated. I know one of the big things we talk about in telehealth is safety and security here. So Jen or Heather, I don't know which one of you wants to kind of address that there, but it's an interesting conversation starter.
So I can start with that. The first thing I want to say is there are so many. There are so many platforms out there, and all of them, at least most of them, have started to develop their own security with regards to HIPAA, privacy, all of that, as well as their own internal security for making sure that they have the right access for appropriate people and all of that. I think the biggest thing here is actually looking at your own practice and what you want to achieve. And then deciding what type of technology will help you facilitate that. Because in general, there are too many technologies out there for us to say one technology is good and another one is bad. There are so many technologies that are good for one person and not as good for another person, just because they have different goals with what they want to do in their practice.
Yeah, and Jen, just a follow-up there, is there one that stands out and integrates with Epic? We don't endorse any particular products or anything like that. That's just not our style.
Yeah,
I was just going to say is that's one of the great things about these kinds of forums is because we, as an independent organization, can't endorse a specific platform, but participants on the line can chat in what platforms they've found to work well for them and perhaps integrate with things. So please share amongst yourselves. We love to be a forum for that.
Definitely. And the other thing I would like to mention is technology is changing every day. Every single day, something new happens, even with a company that's been around 20 years. So just because somebody is not integrated with Epic or one of the other platforms right now, doesn't mean they won't be tomorrow or next week or next year. So The one thing that I always recommend is ask, what is your plan for this? Because a lot of times they have plans in place, they just haven't been able to do it yet.
Jen, should we continue to the next slide?
I think so.
Sure, yes. So we are getting into kind of how telehealth can be used. So one of the things that we've come to understand is that telehealth is flexible. It can be very flexible. It can accommodate multiple sites of care, and it can include multiple participants in one encounter. So think of the patient who's in a long-term care facility. They may have a primary care provider in one building. They may have a specialist in another building or another hospital. They may have their own nurses in the long-term care facility. They may have caregivers outside that want to hear and be a participant within the conversations that are taking place. And all of those individuals from all the different locations can actually come together in one encounter. And that's pretty cool. It's pretty flexible. So in addition, we are seeing additional technologies consistently being introduced to expand communication and provide additional avenues. So we've seen patient portals take off quite a bit. Platform integrations are becoming huge. And again, we're seeing new things all the time, additional features within every platform every day. And the video capabilities are becoming pretty big. So something to continue to keep in mind as you are deciding how you want to use telehealth, and whether or not your current technologies can do what you want them to do, or if you need to expand. Patient preferences have become a very large topic in telehealth. So, the patient may prefer one method. They may also have ability restrictions. If you're talking about a patient who doesn't feel comfortable through video, they don't really want to participate, that care encounter is going to be a little bit restricted, and they're not going to give you their full attention. They may be too worried, and that may not be the best method or best mode of care. Think also of the patient who may not be in an area where they have internet connection, or internet capabilities are very low broadband. In addition, patients may have no issues at all with connection, but they live in a very populated location where they share rooms and share houses and apartments, and they may have little private space, and that may not be the best mode. Video encounter may not be a best mode of care either.
Yeah, and Jen, I think one of the things that came through the chat is sometimes pharmacies have trouble getting a patient on the phone so you can talk to them about their care. And so the ability to be flexible, to understand that patient and their situation, and potentially adjust your communication mechanism based on that patient is huge.
Definitely. Next slide, Lisa. All right, so there are many considerations for telehealth and pharmacy. We pulled out 4 of the considerations that we hear a lot about, and we have seen with our telehealth accreditation alone as considerations that we really wanted to bring forward to pharmacy and discuss here. The first is the idea of payment for services. So it's top of mind for many pharmacists right now. We've had some major wins in this area with COVID. We've been able to be paid for the services that we're providing with testing and vaccine administration. And pharmacists are able to do a lot more than that. We've always been able to do a lot more than dispensing. So these services, however, are not being reimbursed consistently through the traditional payment models. So we do know that this is a continuous fight for pharmacists, and we continue to see pharmacists out there fighting for payment for services, and we hope that that will continue and that we will see that change. In addition, we are seeing contracting arrangements that allow service reimbursement. especially if you're looking at limited or exclusive drug arrangements. So those will be able to provide some additional payment for services if contracted for. Heather, was there something you wanted to add here before I move into platforms? Okay.
That was a great
So as you begin thinking about telehealth, and I mentioned this on the last slide, telehealth and pharmacy, there are so many platforms to choose from. Each one is different based on the encounter type, your goal, what you want to achieve, how you want your patients to be able to communicate with you, how you want to be able to communicate with your patients. Really the biggest thing here is make sure you vet your platform, make sure it will hopefully achieve the goal that you are looking for, as well as have the security that you're looking for. Most of the platforms out there are consistently working on trying to ensure that they have the security, especially because they want to be used after pandemic as well. So they're working on all of that to make sure that they are ready to continue into the future after the pandemic is over. We did talk a little bit about patient preference as well. In addition to what we discussed on the previous slide, the contract provisions will be important to understand if there is payment for service, understanding whether or not that mode of service is allowed under the different contracts. This is a pretty big thing in telehealth right now. As we talked about a little bit earlier, CMS widened and broadened the allowance for telehealth. And they really lightened some of those restrictions through the pandemic. Once the pandemic ends, there is concern about what services will be provided for and how through telehealth. And so that's a fight on the telehealth side, even outside of pharmacy services. And then the last consideration on this slide is a major one. It's one that we talked a lot about with advisory group. As we were holding our advisory groups for telehealth, there were definitely concerns raised by many of the participants about the value of care being provided. So we understand that the care provided may not be the exact same through telehealth as in person. However, the value and quality of that care should be the same. It should be equal. So if you think about a patient with diabetes who seeks care in person, they may have their A1C tested by the provider or the provider's office right there. However, in a virtual encounter, they may be doing the test themselves and then sharing that with the provider. The care itself, the value of the care is aligned between those two encounters, even though it was a different care provided. And then trends in telehealth. So, I'd like to mention again, this is not new, something pharmacies have been doing for many, many years, especially in specialty pharmacy. So here we listed some of the early uses of telehealth and then moved into some of the more recent uses. So starting with remote verification, this is provided mostly in hospital pharmacies. We still see this used quite a bit. Typically, one hospital will provide service to multiple different sister hospitals, say overnight, to make sure that they have that remote order entry going and remote verification. MTM, medication therapy management, has definitely been completed through telephone encounters for a very long time. That medication review with a pharmacist is very common. And then patient management services was a little bit of a step further. And this is where we get into the specialty pharmacy space specifically. Medication therapy management was, kind of a defined section, a defined service by CMS. Patient management took that a little bit further. It applied it into specialty pharmacies. There were some changes. And really, it aligned with medication therapy management in the mode of how it was conducted, even though the care was slightly different. Clinical support, we continue to see this evolving. So provided by a pharmacist to support patient care delivery in a clinic. So if that pharmacist is in a clinic with the provider and the provider is doing telehealth, they do it with them, or they may have their own telehealth encounter. Pharmacist prescribing is definitely becoming a new thing. We're seeing this more and more through video conference prior to prescribing. And then, pharmacies support telehealth by a prescriber. So the pharmacies themselves will employ prescribers to have the encounter with the patient through the video conference. Support services is a new area that we have seen continue to grow, especially as telehealth has taken off. So this is the support organizations that don't provide telehealth directly, but rather they support others providing that care through telehealth. So remote order verification has been used for a while. We kind of talked about this on the previous slide. And as we are starting to see more support organizations, we're seeing that they can provide staff and technology in remote order verification. The platforms, so patient management platforms and medication therapy management platforms, again, have been around for a very long time, and we continue to see them evolve. We continue to see them start to integrate and start to come up with new communication methods. And we continue to see them support their clients through these platforms and work interactively with them. Lastly, patient management services providers help pharmacies set up specialty pharmacies. They support those pharmacies with additional staff, and they can even train or educate staff and support the pharmacies through that method.
And, Jen, I can just add, we've seen a lot of growth in that patient management services providers space. And as pharmacies want to expand their practice into the specialty space, and they may not have either the infrastructure or the resources to do that on their own, leveraging some of these organizations that then, can remotely work with them and collaborate with them on patient care. There's just been a lot of growth there.
Definitely. And the other thing to add here is when we came out with our telehealth accreditation, our 3.0 accreditation, we saw that in it, pharmacy is being supported by different service organizations. Telehealth is also being supported by different service organizations, and those organizations were seeking validation for their support services. So we did create a telehealth support services accreditation. So for those individuals who are looking for validation for their support services, especially if they're being provided through a telehealth mode, that's something that you may want to consider. So again, it wouldn't be a presentation during COVID without talking about COVID. So we did want to bring forward the trends that we're seeing in digital technology and COVID-19. So first, I want to recognize the care that specialty pharmacies have provided through the pandemic. We've seen pharmacies really be able to provide some excellent care and work hard to support their patients through the pandemic. They had to work hard through business continuity pretty strategically. We've seen organizations have to move their staff to home, to a model where they have alternate times that they're coming in so that they're distanced. We've seen a lot of business continuity here. We've also seen organizations really struggle through staffing if their staff became sick. So that, business continuity became a huge thing through COVID-19. However, we also found that specialty pharmacies didn't have to pivot as much or as fast as other healthcare services in the provision of care because they didn't have to implement new processes to provide care. So they already had the platforms. They didn't have to implement new digital platforms in order to be able to provide the care that they were already providing. They didn't have to implement a whole bunch of new support processes to support patients in how they use the digital platforms or how they interact with the patients or how they can communicate with those patients. So they were able to maintain their care delivery methods pretty well throughout the pandemic. And then pharmacies continue to accelerate the different technologies used for communicating. They've always been on the forefront of communication platforms. That's something that pharmacy is really good at, and they have done very well with. And telehealth, or sorry, the pandemic allowed that acceleration because now there were companies and organizations who were even more willing to support that growth. And some hospital clinics with telehealth capabilities were able to continue providing care throughout the pandemic with no issues. They were using platforms to help facilitate that pharmacist conversation, even though their pharmacist may not be in the clinic anymore.
That's another thing that we've, I think, seen firsthand, Jen, just given that we recently have been accrediting a lot of health system and hospital pharmacies as they've been launching their specialty practices. It's been really educational for us to see how those pharmacies are interacting directly with their clinics and collaborating with the folks in the clinics.
Yeah, it's been great. All right. So as we finalize our presentation, we did want to mention there are, 2 areas that we are just barely seeing pharmacies enter and start the discussion on where can we go? What can we do next as a pharmacy industry, as specialty pharmacies? So pharmacy-run ambulatory care clinics is a pretty big one. Coumadin and diabetes clinics have always been, not always, they've been around for a long time. They've traditionally been run by pharmacists, even with a provider as the primary person above. And they can provide services through telehealth as well as individual pharmacy consultants. We're seeing this through genomics counseling and oncology counseling. We're seeing pharmacist consultants arise who are able to provide those services through telehealth. So that being said, additional discussion, what other opportunities do you see? And what are you going to do with the information from today?
Yeah, we really hope that some of the examples that Jen walked through and just some of the trends that we're seeing, we're hoping, that you've seen some of them too and can share that with us and with others on the call, but also thinking about some of those ideas and how they might be employed within your practice. We'd love to hear more about that.
And as you are thinking about all of these discussion questions that we have posed to you, if you have additional questions for us, now is definitely the time to go ahead and put those in the chat as well. And if you have questions for your fellow participants, feel free to enter those. Make sure you select everyone so everyone can see them. And hopefully we can get some discussion going.
Lisa, I think if you're talking, there you go.
It wouldn't be a webinar if I wasn't on mute. I think one of the things is, where are you going to take it? It may not be where are you going to take it right now, but maybe what do you need to learn more about? And I'd love to hear what some people need to learn more about. For us, that actually helps us provide better client education for you. Like I said, my area is the client education piece, and we want to be able to bring you more informational sessions like this. So what do you need from us to start moving in this direction too? We have a question here from Shirley. She asks, does using telehealth or receiving prescriptions from them require any further documentation to URAC by the pharmacy? So I'm assuming this is if you're an accredited client. Jen, do you want to, Heather?
So within the standards, there's not a standard that specifically says when you receive this prescription through a telehealth encounter, you must do X, Y, or Z. There are standards around e-prescribing and making sure, and really more broadly, ensuring that what you are doing is within the regulations and within the regulations that are within the state and or states in which you are in which you are providing services. So it's really important, right, to always make sure that you have that ability to monitor and implement any regulations, because a lot of this is, certainly there are some federal regulations, and a lot of times that can apply to CMS and how CMS is going to look at and or pay for some of these services, but state by state, that's also really important. Think about how that applies to all of your Board of Pharmacy regulations as well. You can see that similarly in the telehealth space. So whereas we're not specifically calling it out within our standards, it's important more broadly to ensure your regulatory compliance.
I think just going one step further on that too, it depends on the service you're providing as well. So when we're talking about prescriptions, we're specifically talking about dispensing services traditionally. If you're talking about patient management services, which is in addition to dispensing typically, you kind of have a relationship started with that patient. You're verifying that that patient is who they say they are. That's kind of developing that relationship and making sure that you're, taking care of the patient for the right disease and the right treatment and all of that. When we're talking about telehealth services, if you're continuing down that line, it's making sure that you know who the patient is and that they're receiving the right service for what they need. And making sure that you have that relationship built, that there's not just a random prescription. Let's say if you're doing pharmacist prescribing, there's not just a random prescription out there for somebody who you don't know.
So we have two questions that I think align. I'm going to ask you them both, and you can kind of figure out how to stretch the discussion so they meet with both. But Rebecca's asking, what pharmacist prescribing services have you seen provided through telehealth? And MB is asking, what barriers do you see for pharmacist prescribing abilities in the future?
Yeah, so pharmacist prescribing is definitely taking off. It's something that I think a lot of states are considering, and it is by state. There's no federal initiative for pharmacist prescribing right now. In different states, the biggest one that we're seeing is birth control. Birth control is a pretty major one. Some states have gone to the complete opposite and just said we're going to make it over the counter, whereas some are doing pharmacist prescribing. And the rules and regulations are very different depending on the state. The barriers really we're seeing, and it actually, a lot of the barriers that pharmacists are seeing in general with services is payment, right? So do you get paid for that pharmacist prescribing encounter, even if you don't dispense that prescription? So you don't get paid for the drug and you don't get paid for the service. How does that relate? How do you handle that situation? I think the other thing that we've seen quite a bit more, we hear a lot about, at least through different areas, is collaborative practice agreements. It's another way for pharmacists to get involved in prescribing. And that is done through the collaborative practice agreement, which does provide an avenue for payment for services.
And I think from the barrier, just to build on that, from the barrier perspective, again, it goes back to, this is going to be state by state. So many pharmacies are providing services to patients in multiple states. It's important to recognize where you can do things and where you can't do things. Now, the collaborative practice arrangements, we've seen particularly, specialty pharmacies that are in, if you are in one area and you have a great partnership with a local payer, a local practice, something along those lines, that's where you see those successful collaborative practice agreements. Again, that's not going to be for all of your patients, might be for a subset of your patients, because that's something that you can do within a certain space, but not necessarily nationally.
Heather and Jen, I always like to ask the presenters this question. What are we looking at in 10 years? What do you think we're going to see? Predicting the future. You may hit it right on the nail, and if not, then we'll come back in 10 years and we'll adjust. Jen, let me start with you. What do you think we're going to see in the next 10 years?
Well, I don't know what we're actually going to see, but I'm hopeful. As a pharmacist myself, I'd love to see us have service rights, payment for services, and be able to do more with our license and be at the top of our education and training. That's what I'd love to see.
Mm-hmm. And I think I would love to see that too. I think that we are going to get smarter and have more technology that can allow more flexibility with patient preferences to how they want to communicate. If you think about in the last 10 years, how we have changed how we communicate, not only with our healthcare providers, but just with each other. I think the ability to determine, recognize on that patient profile, this is the best way to connect with this person, how, when, all of that. I think we're going to make some really great strides, and it's going to improve our patient communication significantly.
Heather, I'm looking forward to that. As one of the our guests said, she said one of the challenges, people don't respond. Well, I'm horrible about actually answering my telephone. But if you send me a text that just requires a yes or no, a 1 or 2 response, that's the best way to reach me. I can do that in a heartbeat and you'll hear from me. So I love hearing that we're going to get more personalized, individualized care that we can decide, hopefully, how we want the pharmacist.
And we're already seeing that some, we have seen pharmacies that as part of the intake of a new patient is, when is the best time to communicate with you? That's not new, but what is the best mechanism to communicate with you? Do you want us to call you? Do you want us to text you? Is the patient portal going to be the best way for us to get, clinical updates from you? So we're already seeing that happen. I think it's just going to continue to grow.
Absolutely. We have a couple minutes for any last questions. If anyone wants to chime it in, we'll give you a minute to chime it in. I've put our slide with our contact information up there. Your business development executives are on the call here. We've got everybody from pharmacy and telehealth and digital health on here. And Nick just chimed in with our social media feed. So we hope you'll join us. We hope you'll follow us. We try to do one digital health and one pharmacy webinar once a quarter or so. So look for something in the winter again, in first quarter of 2022. We'll be back up here on the same platform. Other than that, we got another question here. I love this. With the increase in ease of contact through telemedicine, do you see an increase in patient compliance with treatment plans?
Oh man, isn't that the ideal?
I feel like that's the $1 million question, right? We actually, because we have technology at our fingertips, are people actually going to use it?
Yeah, I mean, I think, and we've seen quite a bit of digital technology in the last 10 years or so come out where, adherence was a big factor. There used to be that pill topper that it would count every time you opened and closed the bottle to see if there was adherence that way. So different technologies have definitely come out with the intent of enhancing patient compliance with treatment. I think, again, it goes back to what's your relationship with the patient and how can you develop that? And that's going to be your best bet for really working with trying to get the patient to be compliant.
Yeah. And one of the things that URAC accreditation does, the specialty pharmacy accreditation does, is within your patient management program, you've got your interventions, and then you need to make sure you have a mechanism to look at those measures. Establish measures and measure them to see if the services that you're providing and those communications that you are offering are resulting in what you want them to result in, right? I think we're seeing a lot of movement here. So I think that I think in the future, we will be able to understand more. Are some of these additional technologies and communications adding this in? Does this result in a different level of care? How are we seeing the measures change as a result, or the result, the data change as a result of some of these newer mechanisms? I don't think we've actually seen it yet. But the good news is that the infrastructure is there for for pharmacies to make sure that they are measuring so that they can track that going forward. But to Jen's point, that is absolutely the hope, right?
Heather and Jen, thank you for a great presentation. It's always great to be on the stage with you here today. Everyone else, thank you so much for joining us. There's going to be an evaluation that's going to pop up on your screen when we close the webinar. And with that, thank you so much for joining us today. It was great to have a good discussion with all of you. And this officially concludes our webinar.